Endometriosis. In 1993, Mary Lou Balwig was one of the 8 women who founded the Endometriosis Awareness Week, which soon grew to 22 founders. The color yellow was established in 1980 with the first yellow brochure, and the words "Ask Me About Endometriosis" were added to help identify the ribbon as an awareness tool. March was decided as the week to bring awareness, as it is not in the depths of winter or in the busy months of summer. It was also decided to have this week held in March to help avoid other big events or holidays. What is endometriosis? Endometrium is the lining of the uterus that sheds during menstruation. With endometriosis, a similar tissue can grow, but it starts to grow outside of the uterus. This can begin during the first menstrual cycle, and it can go all the way up until menopause. The tissue that grows outside of the uterus can form lesions, cysts, nodules, and other growths on different body parts, such as within the pelvic cavity, the peritoneum. This is a membrane that lines the abdominal cavity, on the ovaries, the fallopian tubes, on outer surfaces such as the uterus, bladder, uterus, intestines, and rectum. It can also grow on the cul-de-sac. This is a space behind the uterus. What causes endometriosis? Unfortunately, the cause is still unknown. It has been noticed that endometriosis can be hereditary. Therefore, family history can play a role in the development of this condition. This condition can affect any race from puberty all the way through to postmenopause. And some theories suggest that the body's inability to break down backflow of menstruation, congenital organs, which are genetic causes that are present at birth, metaplasia, which is where one cell turns into a different cell type, or circulatory or lymphatic distribution of endometriosis lesions could all play a role in the cause of this condition, or possibly a combination of these series could also play a role in the cause. So as you can see, there is little to know about what causes endometriosis, which is why I believe we need to bring more awareness to this condition and other conditions like this. What are the symptoms? Well, one of the most common symptoms with this condition is long-term pain within the pelvic area. This pain can be severe just before and throughout the menstrual cycle. It can also cause back and leg pain throughout the menstrual cycle, pain during sexual intercourse, during bowel movements, during urination, and throughout heavy menstrual cycles. Now, many women that have this condition can have no symptoms at all, while others may have multiple symptoms throughout this condition. Some women may experience nausea, vomiting, constipation, diarrhea, or cycling between the two. Reoccurring pregnancy loss, fatigue, and more. How is this condition diagnosed? Early diagnosis of this condition is extremely important. If your healthcare provider suspects you have this condition, you may experience a pelvic exam and or a laparoscopy. This is where a small piece of tissue can be removed and then tested in a lab. This condition can take 7 to 9 years to diagnose if symptoms are dismissed or ignored by healthcare providers, family, friends, and coworkers. This is why it is so important to get a diagnosis as early as possible. This not only leads to one having to suffer from very painful experiences, but it also causes emotional distress as one is being judged. I have to say, I have worked in environments before becoming a holistic practitioner where I have witnessed women being judged because of their pain and symptoms that they may be experiencing. Now, who knows if they had endometriosis, but regardless of the fact, the pain is real, and this is something that needs to be checked out by your medical practitioner and not just forgotten about or ignored. This condition cannot be definitively diagnosed through blood tests and other medical imaging. The really only 100% sure way to diagnose this condition is through the surgery called a laparoscopy. Again, this is where they're taking the tissue and having it tested. So the average diagnostic age in Canada is 27.9 years old. Although most adults report that they notice their pelvic pain and symptoms beginning during adolescence. The average delay from symptom onset to diagnosis is 5.4 years in Canada, with patients waiting for an average of 3.1 years from the onset of symptoms to seeking and consulting with their physician. Once diagnosed, how is endometriosis treated? Well, it really depends for each woman. It depends on the severity of the condition, the symptoms she may be experiencing, and whether or not pregnancy may be an option, at that moment or even in the future. The pain caused by this condition is usually treated with medications such as birth control. Birth control can also have many different side effects, so this is something that you might want to research if you believe that you have this condition. Surgery can help to relieve pain and may improve fertility. However, if the condition is more severe, it is likely that even after surgery, it can reappear. Once you've had surgery, if the pain does not subside, a hysterectomy may be recommended if pregnancy is not an option, as your uterus will be removed and possibly even your ovaries. What about fertility? Research shows that almost 4 in 10 women who experience infertility have endometriosis. This is because inflammation caused by this condition can damage the sperm or the egg and may also interfere with the movement through the fallopian tubes and the uterus. Many women with this condition will realize they have it after experiencing reoccurring pregnancy loss. Holistic practices. As a full-spectrum holistic reproductive practitioner, I like to look at all the different ways we can help support our body in healing. So let's take a look at the energetic qualities of endometriosis. Some of these might include significant insecurity, if you feel disappointment or maybe frustration a lot, if you tend to have emotional eating of sweets and candies and stuff like that. And this condition can also be associated with blaming others. So if you find that you tend to blame others a lot. Now, How can we heal or help heal and clear these energetic blockages out of our way, and so we don't have to deal with the pain and all this stress caused by the condition? Reiki can be very beneficial at clearing these blockages. As a Reiki practitioner in levels 1 and 2 of Usui Reiki, I am not only trained to offer Reiki support, but I am also trained as a space holder. So this does not mean that I'm a counselor or a therapist. I am simply here to listen and validate feelings without judgment. It is important to keep our emotions moving and not keep them inside to grow stagnant. There are many different Reiki practitioners and energy healers that you can seek out, whether they're in your local area or online. And so I would suggest, trying Reiki if you feel like you have an energetic blockage, or even journaling, because like I said, we want to keep our emotions moving. If we don't keep those emotions moving inside of us and we constantly hold in that disappointment or frustration or blaming of others, it's really going to cause dis-ease within ourselves. And so we really got to try to keep that emotion moving. Crying and releasing that energy is not a bad thing. Whether it's journaling, whether it's speaking to somebody that can hold space for you, or whether it's having a Reiki session done where we can offer Reiki on the womb area, on the uterus, on different body parts to help support the body in healing. Another great practice is reflexology. This practice can be incredibly beneficial for supporting the body's hormonal balance and for healing. Through reflexology, we can work directly on the endocrine system. This system is responsible for controlling and regulating the hormones within our body. There's many different ways to have reflexology. You can have it done on your hands. I personally like to work on and have been trained to work on the feet. This is because there are over 1,200 nerve endings in our feet, which means there's more space and coverage area for me to really get into those reflex points and support the body in healing. I am also trained to work on different points to offer relaxation, pain relief. Reflexology is also very beneficial for supporting the body and regulating the menstrual cycle. There's so many different benefits to reflexology. Therefore, if you haven't tried it out, I highly suggest that you give it a try. Whether you think you have endometriosis or not, maybe you just would like some me time, or you're dealing with a stressful moment in life, give it a shot because it is incredibly relaxing. I can tell you from personal experience, my feet are incredibly ticklish. So if you're worried about that, don't worry. That was one of my first concerns when I went in for the first time ever to have reflexology done on my feet. And I have to say, leaving, I was amazed. I didn't feel ticklish at all at any point throughout the entire session. Did I ever feel like I wanted to kick my foot up and scream because it was ticklish? It was incredibly relaxing. And since then, even though I offer reflexology to others, I go in for reflexology on myself because it is important to love ourselves and show ourselves self-care. This doesn't mean you have to go in for a reflexology session all the time. This could be taking a walk outside or whatever. But self-care is very, very important. When dealing with endometriosis, there are some things you may want to avoid, and there are also some things you may want to try. So some things to avoid would be phytoestrogens such as soy or flax or clover. And then a few things you could try are things such as probiotics, vitamin D, or possibly an anti-inflammatory. Keep in mind, it is always best to speak with your medical practitioner if you are concerned that you have this condition. Remember, early diagnosis is extremely important. So we've made it to the end of the video, and I just would like to take this time to thank everyone for taking their time to watch this video and bring more awareness to endometriosis. If you haven't already, make sure to like my video and subscribe to my channel, as there will be more content coming regarding different conditions that we have to go through. There is also a QR code if you would like to print off a brochure with some information regarding this condition. Just go ahead and give it a quick scan, and you should be able to print off your very own brochure. If you would like more information regarding different holistic practices such as reflexology or Reiki, check out my website and Facebook page at Holistic Health Trust, Allow, Flow. Again, I would just like to thank everyone for taking their time today and watching this video. I hope you all have a beautiful day.